Hello and welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. Are the effects of alcohol different for depressed heavy drinkers? A new study from the University of Chicago Medicine reveals that people with alcohol use disorder and depression experience high levels of stimulation and pleasure when intoxicated, similar to drinkers who do not have depression. The findings counter the long-held belief that the pleasure people experience when drinking alcohol decreases with addiction and that drinking to intoxication is mainly to reduce negative feelings as a form of self-medication. Findings are published in the American Journal of Psychiatry. The research followed 232 individuals across the US between the ages of 21 to 35, corresponding to the period when most heavy drinking occurs in a person's lifetime. Half of the study group met criteria for alcohol use disorder in the past year and were evenly divided in terms of those who had or had not experienced a major depressive disorder in the past year. Systematic review shows cold water immersion may be good for our health. Researchers in a new systematic review and meta-analysis found that cold water immersion may lower stress, improve sleep quality and boost quality of life. The study analyzed data from 11 studies with 3177 participants. UniSA researcher Tara Kine says the study reveals time-dependent and nuanced effects on health and well-being measures. Cold water immersion involves immersing the body partially or fully in cold water in temperatures typically ranging from 10 to 15 degrees Celsius, and in this study data was only included if exposure was at or above chest level and for a minimum time of 30 seconds. It included cold showers, ice baths and cold plunges. In this study we noted a range of time-dependent results. Firstly, we found that cold water immersion could reduce stress levels but only for about 12 hours post-exposure. We also noted that the participants who took 20, 60 or 90-second cold showers reported slightly higher quality of life scores. But again, after 3 months, these effects had faded. Attending parties and visiting friends could delay dementia onset, study finds. A study posted online in Alzheimer's and Dementia, the Journal of Alzheimer's Association, shows that frequent social activity may help to prevent or delay dementia in old age. The study included 1923 dementia-free older adults with a mean age of about 80 who are participating in the Rush Memory and Aging Project, an ongoing longitudinal study of common chronic conditions of aging. A total of 545 participants developed dementia and 695 developed mild cognitive impairment. They each underwent yearly evaluations that included a medical history and neuropsychological tests. In addition, a 5-year delay in dementia onset has been estimated to yield an additional 3 years of life and an economic benefit of reducing dementia cost by 40% in the next 30 years. Potentially $5 lakh in lifetime healthcare savings for each person who would eventually develop dementia. Social activity was measured based on a questionnaire that asked participants whether and how often in the previous year they had engaged in 6 common social activities that involve social interaction. For example, whether they went to restaurants or sporting events, played bingo, took day or overnight trips, did volunteer work or visited relatives or friends. Cognitive function was assessed using 21 tests for various types of memory as well as perceptual speed and visuospatial ability. Study reveals taking oral contraceptive pills could reduce risk of ovarian cancer. The primary role of oral contraceptive pill is to prevent pregnancy, but it could also help reduce the risk of ovarian cancer according to new research from the University of South Australia. The findings are published in International Journal of Gynecological Cancer. Screening for risk factors of ovarian cancer using artificial intelligence, UniSA researchers found that the oral contraceptive pill reduced the risk of ovarian cancer by 26% among women who had ever used the pill, and by 43% for women who had used the pill after the age of 45. The study also identified some biomarkers associated with ovarian cancer risk, including several characteristics of red blood cells and certain liver enzymes in the blood, with lower body weight and shorter stature associating with a lower risk of ovarian cancer. Researchers also found that women who had given birth to 2 or more children had a 39% reduced risk of developing ovarian cancer compared to those who had not had children. Thank you for watching Medical Dialogue. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.